Hey everyone, ready for another deep dive?
Always.
Well, today we're digging into chronic pain syndrome.
CPS.
Yeah, CPS, exactly.
That's a big one.
It is, and it's something that like a lot of people think is just, oh, I have pain, but it's so much more than that.
Oh, yeah, way more.
And you sent over some really interesting stuff like that WebMD article.
Yeah, it's a good one.
It really gets into like how, CPS, it's not just physical, right?
Yeah.
It ties into like your emotions and even your social life.
It really does. It impacts your whole world.
It does, and that's what I'm really kind of fascinated by. And then also,
The causes, right.
yeah, the causes are like, it's this whole mind-body thing.
Yeah, it's not straightforward.
No, it's like a medical mystery. So I'm excited to kind of like unpack all that with you.
Me too.
But let's start with the basics, I guess. Like for someone who's maybe hearing about this for the first time, what's the difference between, just regular pain and chronic pain?
Okay, so we all experience pain, right? You stub your toe, you get a headache, but that pain, it goes away eventually.
Right.
Chronic pain is different. It hangs around. It's pain that lasts for like 3 months or longer, even up to years.
Wow.
And then on top of that, to be chronic pain syndrome, that pain really starts to impact your life, like every part of it.
Okay, so it's like the pain is one thing, but then how it impacts your life is what makes it CPS.
Exactly. It's that ripple effect.
Yeah, and I think the article mentioned it was like 25% of people with chronic pain and end up having CPS.
Yeah, something like that's pretty common.
That's a lot of people.
It is. It's a huge number.
Yeah, it's scary. But okay, so let's get to the causes, because I think
Yeah.
that's where it gets really interesting.
Yeah, for sure.
So what causes CPS?
Well, that's the tricky part. There's no one answer. There's no like single thing we can point to.
Really?
Yeah, it's more complicated than that. There's like two main theories that are being looked into, and they both emphasize that mind-body connection.
Okay, so what are those two theories all about?
Okay, so theory number one is all about like your stress response system.
Okay.
So your body has this system, it's like a network of nerves and glands,
Mm-hmm.
and it's how your body handles stress, right? It's like your fight or flight response.
Right, right.
But with CPS, some researchers think the system is like out of whack.
Like it's stuck on.
Kind of, yeah, like their alarm bells are always going off, even when there's no danger.
So they're feeling pain, but it's like their body is amplifying it or something.
Yeah, it's like their perception of pain is heightened.
Wow, that's so interesting.
It is, and then the second theory is kind of different.
Okay, tell me about that one.
This one is all about learned responses and behaviors. So, like, think about it. When you get hurt, you protect yourself.
Right, you baby that injury.
Exactly. You avoid certain movements. You might change your posture.
Totally.
But sometimes those things, even after you heal, they kind of stick around, like your body has learned this new way of being, even though it's not helpful anymore.
So even if the injuries is gone, your body's still reacting like it's there.
Yeah, it's like it's stuck in that pain response.
That's got to be so frustrating.
It can be, yeah.
But okay, so that's how the pain kind of gets worse or persists. But where does it come from in the first place?
Well, that can be a bunch of things. Sometimes it's something common like arthritis,
Oh,
back pain, headaches, things a lot of people experience.
Yeah, for sure.
And then sometimes it's more complex stuff like fibromyalgia or nerve damage.
Okay.
And you mentioned Lyme disease earlier.
Yeah, it's scary how prevalent that is these days.
It is, and it can definitely lead to chronic pain.
And it's not just physical, right? I mean, we talked about the mind-body connection,
Right.
but does mental health play a role in this too?
Oh, absolutely. That WebMD article talked about that people with conditions like depression are actually more likely to develop CPS.
Really?
Yeah, so it really highlights how important it is to treat both your mental and physical health when it comes to managing pain.
That's fascinating.
It is. It all ties together.
Okay, so we're talking chronic pain and all these different factors, physical, mental. That's a lot.
Yeah, it's complicated.
It is, but like, what does this actually look like for someone with CPS?
Yeah.
Like beyond the pain itself, what are some of the other symptoms?
Well, you're in pain all the time, so it makes sense that, people with CPS often struggle with their mental health too.
Right, like anxiety and depression.
Exactly. Those are really common.
Makes sense. If you're hurting all the time, it's going to affect your mood.
For sure. And then it kind of snowballs from there. That's what I mean by the domino effect.
Okay, so what are some of the other dominoes that fall?
Sleep is a big one. When you're in pain, it's hard to sleep.
Yeah, you just can't get comfortable.
Right. And then you're not sleeping, so you're tired all the time. It's hard to focus, hard to do anything.
It's exhausting just thinking about it.
It is. And then, imagine you're tired, you're in pain. It's easy to get irritable.
Yeah, you're probably not the most fun to be around.
That's true. And that can strain relationships. People with CPS often feel isolated, guilty.
Like they're a burden to their loved ones?
Yeah, and in some cases, it can get really serious. Like people lose interest in things they used to love, their sex life.
Oh, wow.
They might lose their job because they can't work.
It's like their whole life just shrinks.
Yeah, it can really take over. And, sadly, some people even have suicidal thoughts.
That's heavy stuff.
It is. It's a reminder that this is a serious condition. It's not just about pain. It affects everything.
It does, and I think that's why it's so important to talk about, so people know they're not alone and that there's help available.
Exactly. There's no shame in seeking help.
So let's talk about that. Like if someone is experiencing chronic pain and they go to the doctor, what can they expect?
Well, first of all, pain is really subjective. What's unbearable for one person might be manageable for another.
Right. Everyone's pain tolerance is different.
Exactly. So a good doctor is going to ask a lot of questions, try to really understand your individual experience.
So like a detective gathering clues.
Yeah, exactly like that.
Okay, so put on your detective hat. What kind of questions are we talking about?
Well, they'll want to know when the pain started, where it is, what it feels like.
Like a throbbing pain or a sharp pain, that kind of thing.
Exactly. Those descriptions can tell them a lot.
And I'm guessing they'll ask about the intensity too.
Oh, for sure. They might use a pain scale.
Oh, yeah, the 1 to 10 thing.
Yeah, it's not perfect, but it gives them a general idea of how bad the pain is.
But isn't that kind of hard to put a number on pain?
It is. Pain is so personal, but the pain scale is just a tool. It's more about getting a sense of how much the pain is impacting your life.
Okay, so it's not about being super precise. It's more about the bigger picture,
Right. And along with the questions, the doctor might also order some imaging tests.
like x-rays, MRIs, that kind of thing.
Yeah, exactly. Those can help rule out any structural issues that might be causing the pain.
Like a broken bone or a herniated disc.
Exactly.
Okay, so we've talked about the symptoms, the causes, the diagnosis process. Let's get to the good stuff, the treatment.
All right. So the first thing to know is that there's no cure for CPS.
Oh, okay.
But that doesn't mean there's no hope. There are a lot of effective treatments. Most people can find relief with the right approach.
That's good to hear. So what kind of treatments are we talking about?
Well, CPS is complex, so the treatment usually involves a bunch of different things.
Like a multi-pronged approach.
Exactly. It's not just one thing, and it's going to be different for everyone depending on their situation.
So it's really personalized.
Yeah, very much so. But some common things you might see are physical therapy, occupational therapy, counseling, relaxation techniques.
Okay, let's break those down a bit. What does physical therapy actually do for someone with CPS?
So physical therapists, they can do a lot, like heat or cold therapy, massage, stretching exercises.
Yeah, it makes sense. Loosen up those muscles.
Right. And they might also use something called TNS, which stands for transcutaneous electrical nerve stimulation.
I've heard of those. It's like little electrodes you put on your skin.
Yeah, they deliver these tiny electrical currents to your nerves.
And that helps with the pain.
It can, yeah. It's thought to block pain signals.
Interesting. So it's not just about stretching and strengthening. There's like a technological aspect to it too.
There is, yeah. And then there's occupational therapy.
Okay, what's that all about?
So occupational therapy is more about helping you adapt to life with chronic pain.
So like learning new ways to do things.
Exactly. Like if you're having trouble getting dressed or cooking, they can help you find ways to make those tasks easier.
So it's about regaining function, getting back to your life,
Exactly. And then there's counseling.
which is important for the mental health side of things.
Yeah, a therapist can teach you coping mechanisms for dealing with the pain, the stress, the anxiety.
They can help you reframe your thinking, learn new ways to manage.
Exactly. And along those lines, relaxation techniques like deep breathing and meditation can also be really helpful.
Yeah, I've heard those can be powerful for pain management.
They can, and they're easy to do. You don't need any special equipment.
You can do them anywhere, anytime.
Exactly. But, for some people with severe cases, those things might not be enough.
Right, what about those people? Are there other options?
There are, for those cases, there are more advanced treatments like biofeedback and spinal cord stimulation.
Biofeedback, that sounds kind of sci-fi.
It is pretty cool. Basically, they use sensors to monitor your body.
Monitor what?
Things like your heart rate, your muscle tension, even your skin temperature.
Okay.
And the idea is that by seeing that information, you can learn to consciously control those things.
So like you can literally see your stress levels going down.
Exactly. And that can help you manage your pain.
Wow, so it's like retraining your body's response.
Yeah, kind of like that. And then there's spinal cord stimulation.
What is that?
So that's where they implant a device that sends electrical signals to your spinal cord.
What do those signals do?
They block pain signals from reaching your brain.
Oh, wow. So it's like intercepting the pain before you even feel it.
Yeah, it's pretty amazing technology.
It sounds intense, but I can see how it would be life-changing for some people.
It definitely can be. And of course, there's also medication.
Right, painkillers.
Yeah, there are different types. Some are over the counter, some are prescription.
But we talked about the risk of dependence earlier. That's still a concern.
Oh, absolutely. Medication should always be used cautiously and under a doctor's supervision.
So it's about finding that balance, managing the pain, but not becoming reliant on the meds.
Exactly. It's a delicate balance.
Okay, so with all these different treatment options, when should someone actually seek help for chronic pain? Like, what are the red flags?
It's tough, people think they just need to push through it.
Yeah, like pain is just part of life. You got to suck it up.
Exactly, but it's not always like that. Sometimes it's a sign that something's wrong.
And ignoring it can make it worse.
Exactly. It's always better to be safe than sorry.
Totally. So I guess like as we wrap up this deep dive on chronic pain syndrome, what's like the big takeaway? What do you really want our listeners to understand about this?
Well, I think the most important thing to remember is that CPS, it's complex.
Mm,
It's not just physical, there's a huge mental component too.
right. It's not just in your head.
Exactly, and it's different for everyone.
There's no one solution.
Right, what works for one person might not work for another.
So it's about finding what works for you.
Yeah, and I think the other really important thing is early intervention.
We've talked about that a lot. Why is it so important?
Well, the sooner you get help, the better.
Makes sense.
Don't wait until the pain is controlling your life. Reach out to a doctor, talk to someone.
Yeah, be proactive, advocate for yourself.
Exactly.
So before we go, I want to leave our listeners with something to think about.
Okay.
We talked about that mind-body connection, right?
Mm-hmm.
So like, what are some lifestyle changes that people could make that might help with CPS?
That's a great question. I mean, there's diet, exercise.
Stress management.
Yeah, all that stuff can play a role. And then there are things like meditation, mindfulness.
Right, like calming the mind.
Exactly. There's so much to explore.
There is. It's fascinating.
It is. And I encourage everyone listening, do your research, see what resonates with you.
Yeah, what works for you?
Exactly.
That's such good advice. Well, this has been a really eye-opening deep dive.
I agree.
Thanks for sharing your expertise with us.
It was my pleasure.
And to everyone listening, thanks for joining us. We'll see you next time.